Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of the Keeping Ashland Healthy podcast with Dr. Ashley and the boss.
Good morning, boss. How are you?
I'm doing well, Dr. Ashley. How are you doing?
I'm doing well, too. Thanks.
All right. Well, good. You sound pleasant this morning. I hope the audience can feel that pleasantness coming through the microphones. Maybe it's because we have a special guest.
Yes, I'm really excited about this one today.
Me as well, because we have talked in the past about early childhood mental health, but we never really unpacked it to the audience and talked in depth because we didn't have the right person in the studio.
Mm-hmm. This is the person.
This is the person. Her name.
Drum roll, please.
Yeah, I don't have that effect. I wish I did. Is Nicole Mann. Nicole Mann works over at Catholic Charities. Catholic Charities is 419-289-1903. Nicole has worked as an early childhood mental health consultant for many, many years. She's well known in the community. She is an expert in her field, and we are excited to talk about what this thing is that we call early childhood mental health. And you're just the right person. Thank you for being here, Nicole.
Well, thanks for having me.
Absolutely. So, again, for our audience, this is your first time on the podcast. Tell us just a little bit about yourself and maybe what all you had to go through to be an early childhood mental health consultant.
Sure. Actually, it was a journey.
Yeah.
So my background is in mental health.
Uh-huh.
I have my master's degree in community counseling from the University of Akron.
That's where I got mine from. That was the best.
Yep.
Nice.
And at that time, after graduating from my program, I started to work in community mental health, like all of us coming out of that program. My interest was definitely with teenagers and with children. I enjoyed that work a lot. And what I found was I kept thinking, wow, if I just would have met this child a little bit sooner, a little bit sooner. And pretty soon, I was the only person at my agency at that time that would take anybody under the age of 8.
Oh, wow.
Because, when we went to school, they sure didn't teach us anything about bringing a very young child into the counseling process.
Sure.
So most of my colleagues just really weren't comfortable at all.
Sure.
I was getting a lot of these younger children, trying to figure out how to serve them best in a counseling setting. And then in 2016, the state of Ohio created the Whole Child Matters grant. And that program, basically the purpose of that was because the state had done enough research that they were seeing that young children in preschool settings were being expelled from their centers at a rate higher than our high school kids.
At the preschool level.
At the preschool level. So our 3, 4, and 5-year-old children were being told that they needed to leave their centers for
behavioral?
Because of behavioral concerns. So the state, and it's great that we live in Ohio because we are definitely a leader in this area. Yeah. But they decided, what we need is someone that can really work with children in the environments where they are. So at home and at preschool or daycare, right? And they decided that each county in the state needed someone with this early childhood mental health consultation credential. Wow. And that's where it all kind of began.
Wow. That's awesome.
Yeah, that is awesome.
Well, I'm glad Ohio was so proactive. I know years ago, this goes all the way back to 2003, 2004, when I first started with the board. I'll never forget, it was my first or second day on the job, and I came in and I opened up my door, and there were a bunch of puppets in my office.
Yeah.
And even in those early days, Nicole, we were doing some early childhood mental health, and they had received, I think it was through, I don't know if it was Devereaux work, but they had all these, puppets and dolls and things, which most people that know me know that those things freak me out. Anyway, so they arranged them strategically throughout my office to get maximum freak out. Anyway, so I didn't know what I had gotten into, Dr. Ashley. I was like, am I supposed to be working with these puppets and these dolls? But even back then, 03, 04, Ashland County was pretty progressive in exploring this. And then, as you say, when Whole Matters came on, I think Catholic Charities was a recipient of some of those dollars that came with that. It was like one of those regional projects, if I recall.
Right,
Yeah.
yes. I work together with a collaborative that is our Northeast Ohio collaborative. There are
Yeah.
10 counties
Yeah,
in
wow.
my collaborative, which just gives me an awesome opportunity to collaborate with other professionals that focus in this
Yeah.
area,
And I may be wrong. You correct me, Nicole, but I believe that you started at the very beginning, and you may be one of the very few left from that original group that started out on that
Wow.
regional grant. There's a lot of turnover over the years.
There has been some turnover. I'm thinking now because we just had a meeting last week. There are 3 of us,
wow.
I think,
Okay, from
that were in that original
OGs.
group.
OGs,
Yeah.
right?
Yep.
That's great.
Yep, we've been around for a while.
Wow. Okay. So, in terms of, your educational experience, it sounds like, again, like me, graduating from Akron, it wasn't really a specialty that we received in our formal training at the master's level, but it's something that, one, you had an interest in. So you started working, but then there was an opportunity through funding to specialize, if you will, or focus. And then you just took that. And then did they develop a kind of credential or something for people that really wanted to focus in on that early childhood mental health space?
Yes.
Okay.
There has been a credential developed that really focuses on that work with children
Okay.
ages 6 and under.
6 and under.
It is that early childhood mental health consultation credential. And there is a lot of training that goes into that. I think because when we go to school, that's just not an area that
Yeah.
is touched upon. So there's a lot of training in assessment measures for children of this age, and then just strategies and resources to bring to parents and teachers to be able to, what we're really talking about, right, is for parents and for teachers
Yes.
to be as prepared as they can be to handle their child's development and possible behavior concerns that come up so that they can be that person then to help that child.
Right, because that's where I was going with my next question, Dr. Ashley. When I talk to folks in the community about early childhood mental health, immediately the idea is, David, are you putting babies on couches? And sometimes I say yes, just to mess with them, but it is not. Correct me if I'm wrong, Nicole, but we are not putting babies on couches. So what does early childhood mental health, you've already touched on this. Obviously the parents in the daycare or the preschool, you're working with the young people, the 6 and under, but you're also working, so maybe just tell the audience, what does that really look like? Because babies on couches sometimes gets in people's heads and they're like, you can't possibly do counseling with these really, really young ones. Can you, David?
If you can get a 2-year-old to sit still on a couch for a half an hour,
Right.
good for you.
Good luck.
But no, actually, it is a little counterintuitive because the primary work is really with the adults in a child's life
Okay.
that are that biggest influence for that child. So most kiddos, we know, spend most of their time at home with relatives or extended family or in a daycare or preschool setting.
Yeah.
So my job is really to support the daycare providers, the early childhood professionals here in Ashland County, so that they know to put their social and emotional or that mental wellness lenses on, to look through that so everything that they're doing in their classroom or in their daycare centers, that they're doing they're being mindful that this child's mental wellness can be affected
I see.
by everything that's happening throughout the day. So, I tell teachers all the time, I'm not a teacher, and I am not an expert on early childhood education. That's their expertise.
Sure.
But what I can do is I can come to them and I can explain that as you're teaching this lesson on shapes and colors and everything else that young children do in their classrooms, that we can also be teaching children how to develop friendships. We can be teaching children how to manage those big emotions if they become frustrated, all of those things. So it just brings a little bit of a different perspective to some of the work that the teachers do. And my job is to teach and encourage them in that.
That's great.
Yeah, and from 0 to 6, you said, right? Ages 0 to 6?
Yes, 0 to 6. Typically, once a child leaves preschool and starts into kindergarten, that then is beyond the scope of what my job does.
Okay.
Yeah.
Yeah, it was such a critical part of development that's happening at that early time of life,
Absolutely.
right? So I think that's great that you're doing that work.
Well, now I understand kind of what you've been doing with me, Dr. Ashley, because I feel like you've been doing early childhood mental health on me because you've been trying to help me manage my big emotions.
That's what we've been doing. We've been working on
Yeah, I didn't realize you were trying to pull some of that on me.
You
but
can apply that at all ages.
I see.
Absolutely.
I appreciate it. I'm going to have to be more skeptical of some of the things you're saying to me. So in what ways are you helping the parents and the teachers then? You're just, as you say, you're more like a consultant, I guess, for both the parents and the teachers in terms of giving them insights on other areas outside of the primary education area, as you said, making friends, et cetera. I thought that was so you're just really giving them skills or suggestions?
Yes, basically. I do a lot of observation in the classroom, which helps me get an idea of just how the classroom is functioning and how the individual children are doing within that. There's really two different ways to approach what I do. The first is when I'm looking at an entire classroom of children, and I'm working with the teacher on this entire group of maybe 15 children that they have. And we're seeing that, for this year, 2024-25 school year has just started, right? So the teachers are really getting to know their children, and for some teachers, they're probably going, wow, this is a very different class than the kids I had last year. So we're looking at that. What is this group's strengths? What are the areas where they have some needs? And how can we just meet all of those things for this entire group? So the teachers looking at activities that would include all of the children in their classroom, or incorporating strategies and things into what they do just on a day-to-day basis. The second part of what I do is when there's that individual child that is struggling, and a teacher may call and say, we've tried everything that we know to do, and this kiddo is just really having a hard time. Can you come and give us some ideas and some suggestions? And at that point, I'm another brain on the team.
I see.
To give that mental health perspective, and to just be part of that team to try to develop a plan for that child so he can be successful.
Yeah, I wondered about that. Because not everybody is as receptive to receiving feedback, or so as you were talking about, observing and then offering. Is that something, did you have to build relationships with some of the school classrooms you're in with the folks so that they're open to that? I mean, I would imagine just some people are just naturally more open to that kind of feedback, where other people might be like, don't tell me how to run my classroom. I'm a trained professional.
Absolutely. And you know what? In Ashland, we have amazing early childhood teachers. We really do. So shout out to our Ashland early childhood professionals. And some of these teachers I've been working with since I started in this position. So they definitely are the experts in what they do, but they know that I can just help bring that mental health, that social and emotional piece, and just make it a little bit more of the focus. For new teachers, there's a relationship building process, absolutely. Nobody likes to have somebody come in and observe their classroom. But I try to emphasize to them, my job is to support them. I am not a teacher. I I can't criticize what they do in their role as an educator.
Yeah.
I can just try to bring that mental health piece to them.
That's great. That's great. And I appreciate hearing that so many of the teachers in the county are very receptive to what you have to say. That says a lot about them. And could you tell us a little bit, if you're allowed, some of the different districts or organizations that you're working with currently?
Sure. Well, any preschool or daycare or even home care provider for a child ages 6 or under has the ability to receive early childhood mental health consultation services.
Okay.
So my services are available to anyone that works with young children here in the community.
That's great.
There are some centers that I like to say they do the full program. I mean, they are committed to working with me as their mental health consultant, and we implement like the Devereaux assessment to be looking at the children and seeing where their strengths are. And
Is that individual based then, the Devereaux? Is that classroom based or both?
Kind of both.
Okay.
The teachers fill out, and actually this year we have several centers that are having parents fill them out as well, which
so
is awesome.
Different lenses of the same. Yeah.
Yeah.
We used to do something similar to that, Dr. Ashley, with the satisfaction and outcome surveys.
Oh,
where
really? Cool.
We got the perspective of the therapist, the perspective of the person, and then perspective of the family. If it was a child, it was always
that.
interesting to get different lenses. So that I think that's a wise approach where it can be
Absolutely.
done.
I think we all know a child can behave very, very differently at home
Yes.
Yeah.
than that child may behave at school, and vice versa.
And that gives you additional information on maybe how you can design your consultation if you have that kind of information.
Absolutely,
Okay.
yeah. It's proving to be very helpful. So I'm very appreciative of the teachers for doing the extra work to collect those parent assessments as well. But those assessments then, I mean, they're done on each individual child in the classroom.
Okay.
So we see for each individual child where their strengths are, where the areas are that maybe the child needs a little bit of additional encouragement or support. But then we can also, like we were talking about earlier, we can look at that entire classroom and see as a classroom where's this classroom strengths and where are the needs here.
Okay.
So, for instance, if a teacher has a classroom where 9 out of their 15 children are struggling with self-regulation and managing those big emotions and are maybe having temper tantrums, we know that as a group they would probably benefit from some strategies to just learn to manage their behaviors and their emotions.
That's great.
Yeah, I love that.
We've been speaking with Nicole Mann. She's an early childhood mental health professional here in our county. She's also licensed as a professional clinical counselor. And she works through Catholic Charities, which is 419-289-1903. And that was one of my questions for audience members that have questions or want to get in touch with you. Is the best way to contact that main Catholic Charities number?
That is the best,
Okay.
yes. I mean, that will go directly to our office where they will definitely get that message to me. I mean, I can also be reached through email.
Okay.
And we can certainly send that information out to your listeners as well. But that main office number is a great place to start.
We can, if that's okay to do, I'll include that in the episode description that accompanies our episode today.
Sure.
I'm just excited because this is another example, Dr. Ashley, of how the Mental Health and Recovery Board and our partners focus on prevention. It's,
Yes.
We've talked a lot about that. When we look at our overall funding in terms of percentages, the board funds more preventative programs than they do crisis or treatment. And that's ideal because we feel like if we can do what Nicole's talking about, get ahead, then we're helping ourselves and everybody down the road.
Right, because a lot of the services in the mental health field, we talk about treatment, addiction treatment, mental health treatment.
Yeah.
But if we can get ahead of the problem and do some prevention work, we'd rather do that. And this is really important, prevention work.
Yeah. And Nicole, we're just so thankful that you're part of this prevention effort, and you have been for some years. And consistency in our field, it's getting harder and harder. I know with the younger generation, sometimes they like to experience different opportunities. So we don't always have a lot of folks that stick with it over the long term. But I think there's some real benefits. you talked about it. You've established relationships with some of our educators in the area. They trust you. They know that they can call on you and you can be helpful to them, the classrooms, the young people, the families. So, and I know you're learning year on year. And quite frankly, Nicole, I didn't warn you I was going to ask you this, but I have to imagine you've been a mentor, either formally or informally, to some of those other counties and regions when you have your get-togethers, because I would imagine folks ask, what does Nicole think about this? She's been doing it for a little while. Does that ever come up when you have some of your regional meetings?
I'm definitely starting to fall into the group of, oh, you've done this for a long time. Well, how did you do it? So,
Well,
and there is a learning curve
Yeah.
because, I mean, as we all know, nothing is ever exactly the same when we're talking about young children.
Yeah.
So things are always different. Maybe that's why this job is so rewarding, because every day is different. But it's amazing to see these young children thrive,
Yeah.
and for parents and teachers to gain confidence knowing that they can handle whatever comes their way with their child.
No, that's great. And you've got them set up for kindergarten and beyond, and that's wonderful. So
Yeah, that's awesome.
Well, we've been speaking with Nicole Mann from Catholic Charities, early childhood mental health expert at 419-289-1903. Nicole, we really appreciate your time today.
Thank you so much.
Thank you so much for having me.
Absolutely. Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.